Hi, I'm Dr. Kelly Starrett from the Ready State, talking about how we might think differently about helping ourselves manage tendinopathy or pain in the heel. If you've ever had pain in the Achilles area or in the back of the calf, this can be really perplexing. So literally, what ends up happening is that we sort of can be immobilized because we're afraid to load it because it hurts, and subsequently we feel like we don't have a lot of solutions to get input in there. I'm going to show you a couple ways today where we can give you some sneaky inputs into the calf. Now, one of the things that we've got here is I've got a roller, which most people are familiar with, but this roller has a little bit of texture here. And what I'm really looking at is how well does the Achilles skin slide and glide over the actual tendon. Oftentimes, for whatever reason, we see that when people are having discomfort in this Achilles region, we end up seeing a really restricted tissue system where the tissues don't slide and glide. What ends up happening is it's almost like the Achilles has become matted down with the sort of overlying connective tissue systems of the skin and fascia. So what we're really realizing is that, man, as this Achilles has to move as the foot flexes and plantar flexes, that system has to be really dynamic and slide and glide. So one of the ways that we can start to restore how those tissues are articulating is by getting some scrubbing in. Now, we get a lot of things in with the scrubbing. One is that we're going to improve blood flow. Two, we maybe even just desensitize this area. I can scrub with my foot kind of pulled towards me. I can scrub with the foot pushed. But the idea here is that I want to look at the area in and around this whole tendon sheath Achilles region and ask myself, do the tissues slide? Now notice I'm not going side to side and I'm not doing our classic mobilization. Instead, I'm trying to scrub and just see if I can take that circumferential kind of connective tissue fascia sheath and get it to move. And you can see that if you touch the skin on your forehead or even on the back of your palm, all of those tendons in the back of the palm are sort of are free from the skin arising above it or below it. So the same thing should happen for the tendon in this region. So a little bit of scrubbing, thinking only working in an area, sort of, hey, I'm going to spend 5 total minutes seeing if I can scrub and get these tissues to re-articulate. This is a small little lacrosse ball, and I can do the same thing with the skin in this area. So not only do I come in classically sort of in the way that we might attack it with a roller, but I can also come in with a ball and get a little bit of motion here in this region. So I can wind up that skin and add some motion. I can just make sure that that skin articulates in this area. And what you'll see is that oftentimes, again, when people come to us and they see that they have pain in this Achilles area, freeing up this connective tissue system restores blood flow, it restores hydration, and allows the system to articulate more effectively. These can be 2 really simple strategies to improve how your Achilles heals as it starts to move towards returned normal function.